Hello everyone, I'm Clinical Clerk Tristan Unay, and for today's video, I will be showing you some basic HENT physical examinations that you can perform, so sit back and relax.
First, we always need to have proper personal protective equipment worn and practice proper hygiene. Properly introduce yourself and secure an informed consent before starting. On head inspection, sit at the same level as that of the patient. Observe position of patient's head, noting for any tilting and abnormal head movements. Note any abnormal facies by checking for facial symmetry, overall facial structures, and any abnormal facial movement. Inspect and palpate the skull and scalp and note for any irregularities, lesions, nits, or scabs. Also note for any tenderness and soft tissue swelling. In elderly, palpate for any tenderness or thickening of the temporal artery. The ear for equal size and shape and note for any lesions or masses. Check for ear position whether the top of the ear touches the imaginary line drawn from the outer canthus of the eye to the occiput. Palpate the auricle between the thumb and the forefinger, the mastoid process using the index and middle fingers, and press the tragus inward and toward the ear canal and note for any tenderness and lesion. Inspect the auditory canal using the otoscope. In this video, we used a reflex hammer but it's not a viable substitute in the actual practice. The patient to tilt the head slightly away from the side being examined. Choose the largest speculum that the patient's ear will comfortably accommodate. With the other hand, straighten the ear canal by pulling the auricle gently upward and backward. Turn on the otoscope light and grasp the otoscope with the dominant hand in an upright position. Gently insert the otoscope in the external auditory canal and note for presence of wax, discharge, foreign bodies, redness, and advance until the tympanic membrane is seen and note its characteristics. Observe for any movement of the tympanic membrane as the patient performs the Valsalva. Repeat the steps on the other ear. For the hearing acuity test, voice test, stopwatch test, Weber and Rene are to be done. To perform the whisper test, stand closely behind a seated patient at most 2 feet distance on the side of the ear to be tested. Ask the patient to cover the other ear, whisper a few words, and ask the patient to repeat what was whispered and repeat on the other side. Weber test is a test for lateralization, and this is done when you place a stroke tuning fork against the middle forehead and ask whether the sound was heard on both sides or is lateralized on one side. Rene is a test for air and bone conduction. Firmly place a stroke tuning fork against the mastoid process and instruct the patient to tell when the buzzing sound stops, noting its duration. Immediately move the still vibrating tuning fork near the external auditory meatus and instruct to tell when the buzzing sound stops and note the time. Compare air and bone conduction and do the same on the other side. Inspect and palpate the nose for deformity, symmetry, inflammation, and alar flaring. Evaluate the patency of each nostril by pressing shut one side of the nose and then the other, asking the patient to sniff. Inspect the internal nose by tipping the head back, placing the thumb against the tip of the nose and looking through the nares using a pen light. Note for any septal deviation and perforation and inspect the nasal mucosa, inferior and middle turbinates. Palpate the sinuses for any tenderness by applying light digital pressure over the bony brow, the nasal bone, and over the maxillary bones. Locate the temporomandibular joint and place fingertips anterior to the tragus of each ear and ask to open mouth. Then slip fingertips into the TMJ and palpate for any crepitus, swelling, or locking motion. Assess for malocclusion by instructing patient to shut his mouth and expose his teeth and ask patient to move jaw from side to side. Palpate for enlargement and asymmetry of the salivary glands and note for any tenderness. Inspect and palpate lips for symmetry, lesion, or tenderness. Examine the underside of the lips and anterior surface of the gums and cheeks using gloved fingers or gauze. Instruct patient to say ah and note for its texture, symmetry, and protrusion of the uvula. Ask patient to tilt head back with mouth open and examine the palate with a pen light or dental mirror, ideally in a dark environment. On neck inspection, ask patient to hold head and neck in a relaxed position and observe for any deviation, bulge, and outlines of thyroid and cricoid cartilages. We are using a posterior approach in this video. Stand behind the patient's slightly relaxed neck. Put your thumbs at the back of the patient's neck as you place your fingers below cricoid cartilage, palpating the thyroid isthmus as the patient is asked to swallow. Ask patient to turn her head slightly to the side and palpate the lobes. Use fingers of the opposite side to displace the gland in the lateral direction while the patient swallows and repeat on the other side. Using the bell of a stethoscope, auscultate for bruit over each lobe. Ask patient to relax with neck slightly flexed forward, simultaneously palpate and use the pads of the index and middle fingers in rotatory motion with the left and the right side of the lymphatic areas of the head. Thank the patient and dispose of all the used materials properly.
So basically, that's it for today's video. I hope you learned something and thank you so much for watching.